Hi, my name's Ellen, and I'm going to be demonstrating a basic IV insertion. So based on the doctor's orders, the time and duration of the IV being in place and the medication administered, I'm going to use a 20 gauge catheter. So I'm going to gather my supplies, including the needle and catheter, tourniquet, tape, alcohol wipes, tubing, and first I'm going to draw up 3 milliliters of saline.
The difference, okay. I would recommend the difference in volume in between saline and draw. I will also document the color and the consistency of the
3 milliliters.
and document any difficulties in the irrigation and patient response and also patient
Okay.
And again, my name is Iv Insertion and that is my insertion.
Cap the needle. There we go. Okay.
All right.
So I'm going to dispose of the needle in the sharps container and attach it to the tubing that will attach to the IV.
That's okay.
And I'm going to prime the tubing.
Do everything. So I remember when I'm talking about a patient to remove.
Alright, so we're set for the saline flush. So I'm going to set that aside. And now I am ready to go into the patient's room. I'm going to bring the catheter, tourniquet, the tubing, and the alcohol wipes and tape, and my MAR. So knock, knock, knock. Hi, my name's Ellen. I'm going to be your nurse today. The doctor has ordered an IV so we can administer some fluids and some medicine. Can you tell me your name and date of birth? Okay, so it matches. I'm also going to assess for allergies, and I'm going to find a vein on the non-dominant arm at the most distal site, and a vein that is bouncy and that has not been infiltrated or blown. So I'm going to use this site right here. Apply a tourniquet 4 to 6 inches above the insertion site.
Check. Then you set yourself up good. All right. So you said we're good. So you assess.
Okay. So first I'm going to
Measure.
clean the
Apply glove.
insertion site, starting inward,
This is a lot.
moving outward.
No. Not yet. I gotta put my stuff in order.
Okay, gonna let that dry, and while that's drying, I'll wash my hands and put gloves on. Okay, so now that the site is dry, I can insert the
Let me get my tape.
IV.
That'll make me just use that tape.
And we're going to go in at a 15-degree angle, bevel up, pulling the skin taut in the opposite direction. There's going to be a little stick for a flashback, and we have a blood flash. So I'm going to advance the needle another 1/8 of an inch, and then advance the catheter. Apply pressure. Those of that in the sharps. And attach the tubing and release the tourniquet. Alright. Now on clamp, aspirate. We have blood returning, so I'm going to administer 3 milliliters using a push stop method. Alright, going to clamp this off and unattach this. And now apply use this to initial date the catheter size, and I would attach it right here. And the size, you can still see the insertion site. And I'm going to tape this secure to the arm. Okay. So I'm examining the IV site. There is no redness or swelling, no tenderness. So now I would document in the charting and in the medical record the IV insertion site, the date and time it was administered, how well the patient tolerated it, the instructions I gave the patient, how many attempts it took to get the IV inserted, and